As the world enters its third year of the COVID-19 pandemic, the World Health Organization Director General Tedros said that he is confident and optimistic that the pandemic will end in this year or 2022 only if we end inequity. And according to him, if we end inequity, we end the pandemic. So let's go deep into this and understand when and how the pandemic will really end. Here we will discuss two different scientific aspects to understand it further. Number one, virus mutation, and number two, human immunity. First, virus mutation. Many of us till now have noticed that Omicron generally causes mild illness and hence the low death and hospitalization rate. As the new variant appears to affect on the upper respiratory tract and spare the lungs, there is a little demand for oxygenation and ICU beds. Here it is to observe that the Omicron infection spreads with extremely high speed but caused much milder illness than its earlier strains. But the question comes, how is this possible? Because this strain has substantial difference in its pathogenic process that lead to differing symptomatic outcomes. Omicron is localized to the upper respiratory system, that is your nose, throat and windpipe, where Delta or Delta Plus mostly affects on the lung tissue. This difference between Omicron and its ancestors can be understood as they have difference in their spike protein. The SARS-CoV-2's previous variant's spike protein is cleaved into two subunits. This is called spike furin cleavage sites and attenuates cell fusion. While Omicron continues a cleaved spike as well, recent studies indicate that it may be less efficient than its earlier strains. The reduced cleavage spike protein makes Omicron less likely to bind with our lung protein called TMPRSS2. This is no doubt a positive sign and signifies due to the continuous mutation of virus, although it has increased the capacity of spreading, that is 25% more infectious, but reduces its potential to harm on lung tissue or to produce severe lung damage like its previous variant. So we can understand that in future the virus mutation may be less efficient to harm us what we have seen in the first two phases. Next we will discuss the human immunity. Now frankly, eradicating this virus right now is unrealistic. But in a large study among huge number of people, it was found that people who have or had COVID-19 previously, their levels of neutralizing antibodies in their blood increases. And this can also make memory B cells from which our body can produce antibodies against COVID-19 in future. Even a new infection or a strain arises and can also produce T cells that can eliminate or kill the virus. Neutralizing antibodies helps us to block the reinfection, and due to this Omicron variant, scientists have found that more or less most of the world population has already developed these neutralizing antibodies either through natural infection or vaccination. Along with this, as countries started to distributing COVID-19 vaccines to its population, the virus have to go through lot of mutation to make a vaccine ineffective even in future. Previously, in different other pandemics like in 1918 Spanish flu pandemic, where more than 50 million people were died. In 1957 we have seen H2N2 pandemic. In 1968 we have seen H3N2 pandemic. But in most of the cases we have found that pathogens stop spreading because so many people are protected against it either via natural infection or vaccination. That is, the host response against the virus has increased rapidly. So in this case also, our immune system learned enough to fend off the deadliest manifestations of infection. And global models suggest that over time the virus will come to trigger small surges of milder infections like seasonal flu. and in very near future the pandemic virus became a seasonal flu endemic. And it is definitely going to happen, and the Omicron variant is a positive signal, or we can call the start of the end of this COVID pandemic. So we can understand, due to number one, as our immunity learned to fight against the virus, that is our host response has increased, and number two, as we can see that due to the continuous mutation the virus became less effective to affect our lung tissue. We can clearly predict that in 2022 we can expect the end of pandemic. And this is not only my prediction. Globally, super virologists and renowned scientists have also predicted in this way. But in the next or upcoming 2 years, it is very important. Countries and all people must reduce the transmission of the virus with proper control measures until more or less 70% of the global people are being vaccinated. But if we are reluctant, this time the darkest days of pandemic are still ahead of us. So we have to be very much careful, and we can expect by the end of 2022 we can live in a world without having this kind of fear of pandemic. Now share this information with your close ones and subscribe the channel to get the latest scientific medical tips and information. Take care.